Thank you, and good morning to everyone. Dr. Akhilesh Gupta, uh, our esteemed guests on the dais, Ms. Urvashi Prasad, Mr. Harsh Mangla, Dr. Madan Gopal, Vikram ji, and uh, Gupta ji. So, thanks for having me here, and it's indeed a pleasure to be part of any Elets conference or event. So much so much to learn, and such intersection of wonderful speakers always are present here. And healthcare innovation is a very relevant topic after COVID, because the greatest innovator is actually nature itself. And what COVID has taught us is like disease is the virus itself was reinventing itself over the past 2 3 years, and we had to catch up and change our game as the disease progressed. And people predicted it's going to take at least 3 years, and we're all here physically because we were able to kind of beat it, but at a huge loss. The number of lives lost is not less. Uh, so it has taught us a lot of things, that healthcare is actually something which we are not take for granted. So innovation itself, I think, is a very it's a very common, and the term is means so many for so many versions for so many people. In a sense, I think we should look at innovation as something. It is not really discovery of something new, but even if you're able to improve something which exists, that itself is also an innovation. You're not an inventor, you're an innovator. You're changing something. A small example will be like a ink pen turning into a ballpoint pen, turning into a gel pen, and that turning into a digital pen, and so on. So it's not invention, it's kind of reinvention, improvement. In healthcare, the scope is so huge. Uh, the, there's a big question: is there innovation in healthcare, innovation in government? I mean, we have from looking after digital health mission. It's one of the thanks to the great vision and leadership of our honorable prime minister. It's actually a reality. I mean, we're all proud to be part of that ecosystem of the digital health mission. It's a groundbreaking. So yes, it is possible to innovate in government and with government. And in the last few years, we have seen so many things coming in. But without taking much time, I would like to present to the viewers and the people present here. We look at healthcare innovation, it's so vast. Let's step back and look at the big picture for a minute. Do we really know the biology of the diseases? Do we know the biology of the pathogen? So the innovation could start from raw biology itself. Now we have AI systems, deep learning models, actually uncovering the biology of the disease, the biology of the pathogen. So we're able to understand what causes the disease. So at a biology level is pure science, understanding how it manifests with the person. So that could be also a very new field, which is again uh, personalized medicine, general medicine. So this is going to be a big dawn of genomics. So where you're, we run meetings all day. We meet hundreds of people in the field, and so for less than 25,000, you could get your gene map right now in India somewhere, right? Unheard of. Like 10 years back, it costed you like 10,000, $20,000 to do it. Now it's like 25,000 rupees, you get a rough gene map, and you can know what your which genes are likely to produce what in your lifetime. And you can alter your life cycle, you can alter your, you can take steps. So understanding disease, then you're coming into genomics, coming into personalized medicine. Not, let's not talk about breast cancer. What subvariant of breast cancer do you have? We do so many markers. Now we are going into the immunotherapy, which is giving so much relief to people. That's based on genomic analysis. Mind you, we are running genomic analysis on the pathogen also. We are running. We would not have beaten COVID unless we understood the gene of the virus. You've heard of CRISPR, the gene editing tool. So we could make the virus antivirus because we had desktop gene editing tools, unheard of 10 years back. CRISPR is a groundbreaking thing. Now, again, we go from there to medicine and medicine models. So, do we have enough understanding of how the disease presents itself? Uh, you know, to confess, I quit medicine. I went to engineering, even though I held head the health department, basically engineer. A lot of engineers are there in medicine. The disease model itself is a big business case. People in the private sector modeling disease is a big thing. What I mean by modeling disease is in a scientific way. Sir heads the scientific department, so we look at a disease model, and we do is like we run uh, possible solutions on that model. We refine the model and we treat the patient and we see if it works, like drug trials in cancer. So AI is going to really build better disease models. I took a look at disease modeling. I was interacting with some people from Singapore. So they have modeled the entire city of Singapore as a virtual city. You can change couple of roads, direction of the traffic. You can understand how the whole city is going to react. I've met people who have done virtual digital hospitals. You do a digital twin. We had a delegation from Sweden healthcare. In fact, mm, we are in talks with Karolinska Institute. Government of Maharashtra is the Nobel Prize Institute. They are keen to work with the government of Maharashtra, and we are trying to do some innovative things with them. So you have a digital twin of a hospital. If you want to make some changes, the digital twin will actually help you understand what the impact on patients, the queue maybe, and if you change ICU beds, you will understand everything. Similarly, you can have a digital twin of the patient. You have enough data of the patient. Now, patient. Now, I was just talking to some really very high profile doctors in Mumbai. They said, like, look, the greatest innovation in healthcare, I think, was the stethoscope, right? Then came the hypodermic needle, and now we have like whatever gene therapy and so on. Stethoscope is like outdated now. Nobody, don't see what doctors going on there. In the US, apparently, I have not seen the device. So you have a small portable ultrasound people carry. They just put the thing on the patient and it's done. So looking at patient, uh, slowly the patient is not even held, touched by the doctors. The patient has become a data set. It's just a floating data set of so many parameters. So hence telemedicine. Do you really need to examine? Can a machine examine for the doctor? So telemedicine is one of the biggest changes which we have seen due thanks to COVID. Again, drugs, drug delivery, drug discovery. These are in the industry. People know it. AI is going to make big changes. Chemistry itself is going to be looked at very differently. Virtual reality and chemistry are going to interact majorly, and you'll be able to visualize new molecules way better than before. All this has nothing to do with the patient. Now, how are we going to deal with the patient? Are there enough? Is the better way to handle the patient? Are you running better hospitals? That is actually a challenge for us in a country like India. Uh, Maharashtra, let me give you my example. I try to be as quick as possible. So, I have 1,900 PHCs, 10,000 subcenters. Uh, I have about uh, a lakh and a half paramedical staff. I have about 20,000 doctors, huge systems, and 200 plus hospitals. And we have close to uh, 3 to 4 crores OPD patients. And we have the data like we ran 28 lakh X-rays alone Maharashtra last year, 22, 23. Huge numbers. Are we giving quality? So the patient handling, patient data are very interlinked. Digital health mission is going to really look at that. The electronic EMR and EHR. And one of the great things the digital health mission has done is the bringing fire standards. FHI are standards. So there's like if you get into that world, it's very interesting. SNOMED, fire standards. That's the way we are getting interoperability between public and private. Setting data standards is a big thing which the digital health mission is doing. And lastly, I want to highlight this, that are we looking at the data we have? We don't. So, the data analytics world knows this, but still, in the interest of repetition, it's like descriptive analytics, what's happening, diagnostic analytics, why it is happening. And then we have predictive analytics, it's like when is what is going to happen. And lastly, prescriptive analytics, it's like what you should do, right? So, we are nowhere in that picture. The digital health mission data will get it slowly in this sequence. And lastly, I think we look at finance in healthcare. So has got a very large PMJY, and uh, we have a Mahatma Jyotirao Phule uh, insurance-based scheme. More than 10 crore people out of the 14 odd crore persons in citizens in Maharashtra are covered by healthcare. 10 out of 14 crores are covered in healthcare through insurance mode. In fact, tomorrow, the Honorable Union Health Minister is visiting our state. We are going to expand that. We give up to 5 lakh health cover for more than 1,000 secondary, tertiary healthcare facilities in 1,300 hospitals. Paperless, cashless, and instantaneous healthcare to people. This is the vision of the government, and there's a lot of tech going behind that. And I'm sure in the coming years, this is going to be the model where we are able to give paperless and cashless treatment to people. And most importantly, what is the business case for health finance in uh, India? I think apart from the health insurance, there's so many things can be done. Uh, when you talk about finance, it's about financing startups, financing innovation, financing the patient care, uh, and also reducing the cost of treatment. And one more area which I think is a great innovation, pardon the pun, it's a green field. Why I say it's a green field? Nobody's talking of green hospitals. Thanks to COVID, plastic is king because we all like kind of survived because we use plastics one way or the other. Disposable world. I mean, we have built mountains of garbage, but we saved ourselves. So, what is the energy footprint of hospitals? Can we reduce cost for the hospital by making it greener? What is the environmental load of hospitals? And this is also going to be a big business case. I think the overall healthcare is going to see a lot of innovation in the coming years. I mean, machine learning and AI is going to do that. Iris scans, video analytics. So you don't need. If I'm like put a video analytics thing on this room, the video analytics deep learning model will tell the uh, pulse rate of every individual sitting here. How the machine can actually read the microscopic movement of the person when we breathe, which is linked to our pulse rate. That microscopic movement will be automatically derived as a almost 90 plus percent accuracy of your pulse rate right now. So you don't need to even touch the patient. Iris scans are way better proven uh, than X-ray scans. To its iris scan is going to be the easiest thing to do next to genomics in predictive healthcare. These are some phenomenal things which are happening. Government, we are very keen to uh, encourage these participants. In fact, I'm happy to share with you, Maharashtra is the first in the country. I had the great privilege and quite humbled to be part of creating a new authority, the Maharashtra Medical Goods Procurement Authorities. And we created an act. I spent like 3 months drafting it under the chairmanship of the Honorable Chief Minister. We set up the first procurement authority uh, in the country by statute, not just a corporation, which looks at the whole procurement process of medicines, medical equipment, consumables, drugs, you name it. Also looking at in the context of trillion-dollar economy that we aim at looking at health tech industry coming to Maharashtra, looking at pharma coming to Maharashtra, looking at medical tourism, and so on. So the new health authority is going to be we just concluded the meeting last week of the first meeting of the authority. The next years to come, we'll be interacting widely through the industry to pick up new ideas. So we have given enough leverage to this authority to encourage innovation. So the procurement authority is not going to be just based on L1 and QCBS. If we find innovative technology coming up, the authority will have the statutory power to encourage good technology and at good cost to people. Ultimately, is to provide excellent healthcare, affordable healthcare, and value-based healthcare to all in our state. So, on this note, I welcome all of you to visit Mumbai and Maharashtra, and we have innovative solutions. We are definitely open to looking at them, and there's a lot to do. And we are all in this room because we are all interested in doing it. Once again, thanks to Ravi ji and his excellent team as usual. And I think this is the first physical event I'm doing after like COVID. Happy to be here and wishing all the participants a wonderful day. Thank you so much.